Okay, great. Well, appreciate your time. So get started. As you may have heard, we are recording this so that others who were not able to join at this time can listen in. And also, we can send this link out to yourselves and you can watch it at your leisure and share the recording as you wish. I'd like to begin by really saying thank you for your time. We are going to keep this brief and just share with you some information about our evidence-based diabetes prevention program called Small Steps for Big Changes. So I'll get started here by acknowledging that this work and the conduct and the development of this program was on the unceded and unsurrendered territory of the Syilx Okanagan Nation, home of the Okanagan people. And this is a picture of our campus at UBC Okanagan, where my lab is situated. We also want to recognize that much of this work is done in the delivery across Turtle Island, and we're grateful and acknowledge the caretakers across Turtle Island for this land. So many of you know this, but briefly, current statistics tell us that 1 in 5 Canadians has prediabetes. That's nearly 6 million Canadians. And this is concerning given that more than 80% of those individuals don't know they have it until they're tested by their or received orders for blood requisitions by their healthcare practitioner. Of those individuals, 70% will progress to type 2 diabetes if left untreated. Now, the good news is, of course, there have been landmark diabetes prevention program trials. So these efficacy trials, including the American DPP done over 20 years ago, the DAKIN China study, the Finnish study, these have all demonstrated that diet and exercise modification can sizably reduce the risk for developing type 2 diabetes, and in fact, quite effectively. Now, the challenge with these landmark DPPs is that they're both time, cost, as well as human resource limited. So quite costly in these three domains. And the challenge with these associated costs is that it further reduces the access of such efficacious programs to those who are most in need. So we know the individuals who are historically and persistently marginalized are less able to access programs run at research intensive institutions. And so that's really why we developed Small Steps for Big Changes, a diabetes prevention program designed to overcome the gaps in those past efficacy trials. So specifically designing it to be cost effective, designing it to be low burden on communities to deliver it, not requiring highly licensed and qualified individuals to deliver it, but rather developing our own train the trainer program that certifies individuals to deliver it in their own communities. Briefly, Small Steps for Big Changes is a one-on-one counseling intervention designed to focus on empowering individuals at risk of type 2 diabetes to maintain their diet and exercise behavior changes over the long run. It consists of 6 1-hour one-on-one sessions, and the core principles within it are motivational interviewing. And so with motivational interviewing, we focus on, again, empowering the individual, listening and appreciating their perspectives and their lived experience. The intervention components for this you can see listed in the green box. So within each of our 6 1-hour sessions, we focus on the most potent behavior change techniques we know for facilitating behavior change, specifically those tested for diet and exercise behavior change. So really our motto, and this is what we certify in this accredited program, is acknowledged by fitness organizations such as BCRPA, is we teach our counselors to employ a conversation rather than a prescription. So really we do a lot of listening and not a lot of telling. Now, I don't want to belabor all of the research we have done over the past 10 years to develop and rigorously test small steps for big changes, but suffice to say that we have well over 2 dozen papers demonstrating the effectiveness of this intervention, and I'm happy to share that with others if you reach out to me or my team. What I do want to highlight today for the audience is the effectiveness of the program. So I'm going to share with you, as you can see on this first slide, some of the results of the effectiveness after testing this within a community delivered by community laypersons. And these results are summarized of over 350 individuals that came to us after presenting with an HbA1c indicative of type or prediabetes, sorry. So they were within 5.7 to 6.4% HbA1c range. And after they engaged in our very brief 4-week diabetes prevention program, we monitored them at the 12-month mark. So 12 full months after they completed our brief program. And not only did they have the reductions immediately post-program, these were sustained for 12 months. And that's what we're most proud of for these individuals, is that they sustained the reductions in weight, the reductions in blood pressure, waist circumference, and they sustained their improved cardiorespiratory fitness as assessed by this validated 6-minute walk test long after the program ended. Similarly, very impressed that the individuals maintained their behaviors for up to 12 months after the program ended, including an increase in physical activity, moderate and vigorous minutes by 50 minutes per week, which is quite sizable when we look at the physical activity literature. Similarly, diet, we focus on enhancing or increasing vegetable consumption, reducing added sugars, and reducing refined carbohydrates. And that's exactly what we saw participants do, again, sustained after 1 year of the program. Most importantly, from a clinical perspective, however, is that 1 year after completing our program, 41% were below 5.7% HbA1c, and a further 16% were sitting exactly at 5.7%. Now, many of you are likely wondering, because Diabetes Canada and the Canadian recommendations are that prediabetes sits within 6.0 to 6.4%. So of course, this would affect our results. It would be essentially 57% were no longer considered pre-diabetic at this range. The reason we chose 5.7 to 6.4% is because this is what all other landmark trials have utilized when they're analyzing the effectiveness of their program. And that's in alignment with the IDF, the International Diabetes Framework, and the World Health Organization. So to date, more than 700 people have completed Small Steps for Big Changes across various settings in health and fitness facility centers, such as YMCAs and parks and recreation centers. And we're really proud that 95% of those who join our program complete our program. Currently, we're in 18 cities across Canada, as depicted here. And this is as a result of generous funding from the Canadian Institutes of Health Research. And with the support of the Public Health Agency of Canada, this year and moving into next, we'll expand to a further 52 cities across Canada as depicted on this map. So this brings us to where we're hoping that we can attract your attention. We are here to enhance and improve the health of Canadians across. As you've seen in our map there, if you have patients with prediabetes, we welcome you to connect them with our team so that they can receive our evidence-based diabetes prevention program. Now, this is a research study, so we do have some eligibility for Small Steps for Big Changes, and these include being of 18 years of age or older and considered at risk for type 2 diabetes. Now, the way we've defined at risk is the following ways: physician diagnosed, HbA1c value between 5.7 or 6.4%, or a type 2 diabetes risk assessment score of 5 or greater, which I'll show you on the next screen. We also are considering individuals who are currently in type 2 diabetes remission, and we use the Diabetes Canada clinical guidelines definition for remission, which is achieving HbA1c of less than 6.4% without the use of diet-related medications for a minimum of 3 months. This is the risk assessment score that I was referring to. When individuals are referred to our website, if they do not have a physician diagnosis or their A1C recent scores, they complete a series of these 7 questions that you can see listed here, and we automatically calculate their score. So if they score 5 or higher on these questions, they are then welcomed into the program. So essentially what we are encouraging people to do, and you may see this around your city or town, is this QR code on the top right hand. And so anybody who takes a picture of this QR code is welcome and to join or assess their eligibility. So it takes them right away to the eligibility for this study. If you're interested in connecting your patients to the program, you can direct them right away to our website or to the QR code if you have it. And how you get it is just by letting us know that you'd be open to receiving Small Steps for Big Changes brochures or information sheets for your clinics. Again, that has the QR code on them, and we're happy to send you materials, and you can specify to us which materials you would be most open to. I think I just want to really end off with is reiterating that we really respect that healthcare practitioners' time is very limited, and that each healthcare practitioner is always trying to do the best for their patients. We have an evidence-based EPP that is of no cost to individuals, and we have quite rigorous and robust research findings to back the evidence up. And so we'd love for you to share this program with them, with your patients. We do get to spend over 6 hours of time one-on-one with individuals who join our program. And so we talk about diet and exercise, we listen, we set goals with individuals, and really, again, with a 95% completion rate, people who go through the program are quite exuberant about the effects that they've found and find, of course, with many of our qualitative work demonstrating that they find it quite useful to them and really life-changing in many instances. So again, it's evidence-based, it's free for patients. And we are continuing to measure outcomes that are of clinical relevance. So HbA1c, but we're also measuring anthropometrics and cardiorespiratory fitness, and of course, behaviors. The program is focused not just on making initial changes, but rather we focus on the maintenance of changes. And we know that patients are concerned about the ultimate improvement in quality of life, which go hand in hand with those improved behavior changes. So again, if you're interested in sending individuals your way, or our way, sorry, we welcome you to reach out to us. This is my personal email address, mary.jung@ubc.ca. As of course, we also have a study website, smallsteps.bigchanges@ubca. We're happy to share with you any materials, as well as any of our past papers if you'd like to see. Or you can take a picture of this QR code if you're curious as to really what your patients might see if they were to click on the QR code. You're welcome to take a picture of this QR on the screen right now, and we'd be very happy to share materials and with the QR code on it. So with that, we have time for questions, and really what we'd love to do is hear from you. Any questions you have about the program or anything that I've just mentioned or something that I breezed over that you'd like more information on, we can open the floor for questions. If you don't have questions, we'd also love to pose some to you. We're always interested in how to effectively spread awareness to healthcare practitioners about our evidence-based DPP. So we'd love to hear your thoughts on how we can effectively spread this awareness. And we'd also love to know, how do we make your jobs easier, essentially? How is information shared? How can we best facilitate that with the resources that we have? All right, well, I'll leave it at there and see if there's any questions. And thank you for your attention during this time.
Harry, we've got a couple questions here. One person is wondering what type of dietary advice is provided in the program.
Right. Yes. Excellent. Thank you for that question. So we respect that the counselors, the deliverers of the intervention, are not registered dietitians. So we only can provide information that is recommended through the Public Health Agency of Canada to all Canadians. That's publicly available information on things like the My Food Plate. And those recommendations are consistent to any Canadian who is an adult, which includes, I briefly mentioned, increasing or making sure there is adequate amount of vegetable consumption. We teach how to self-monitor for added sugars, and we use Canada's recommendations for the limits for men and women for added sugars. And then we talk about refined carbohydrates and considering replacing those with more complex carbohydrates.
Another question we have here is what areas are you expanding to?
Yes. So I wonder if it's easiest to put up on the map, but we are currently in 8 provinces across Canada and over the 52 sites across Canada. Um, there's a lot, but they are all urban cities. And I think maybe perhaps I'll just um, switch over because this might be easier on a map. Um, I can just quickly pull back. Apologies for the rush of slides here. Oh, I think I can do it this way. Here we go. And yeah, so this doesn't pinpoint the exact city locations. We tried to on this small map, but you can see crudely the locations. But I'm happy to, if you share if you're interested in a particular city, then let us know, maybe in the Q&A or have you. I also see lots of questions in the Q&A box, Kira. Maybe I'll try and answer those as they come up. Is that okay?
Yeah, that sounds great.
Great. I just don't want to miss any. So one great question is, what happens if there is no small steps for big changes located where, what particular city you are at? So for sure. So on our website, if you go to the website, will automatically move the map to where your IP address is and share with you roughly where the closest location is. But there's also, I believe, a drop down menu of all the places that we are located. If you are, unfortunately, if it's not directly where you are, we'd love to hear from you still. We're in the process of considering a virtual program, which of course we would be more accessible to you. We're not quite there yet, but we'd love to hear from you so that we can add you to that list and respond to you directly. And there's another great question about the waitlist time for individuals who are interested in joining the program. Thank you for that. Right now, in the locations that we have listed here, we are trying to have no waitlist time. Currently, in a couple of our sites, there is a waitlist occurring just as we train the trainers. That takes us a few weeks to ensure that their skills are of high caliber. But we hope that that's not a limit at all. Uh, and then another great question that's right underneath is about what training small steps for big changes coaches have. So yeah, thanks for that. So we have an evidence-based train-the-trainer program. And why I say it's evidence-based is because in the design of it, we've tested it multiple times to ensure that it increases the knowledge of those who receive it, increases their self-efficacy or their abilities and confidence to deliver the program. And we've tested it for fidelity. So when we train individuals, can they take those skills and deliver it with the skills that we are striving for them to do, so high quality? And we've tested the maintenance of the fidelity. So how long do they maintain those high skill levels? Um, and so what this looks like in terms of training is 7 asynchronous modules that include a variety of resources and videos to watch and rewatch as many times as they'd like. And it takes roughly about 3 weeks for individuals to go through the training. And we do have both knowledge tests and then one-on-one mock interview tests. So in other words, we pretend that we are an individual they would take through the program to make sure that we're satisfied with the quality of training that they would provide. They must pass both before they move on to delivering it. And did I answer the question? They are not healthcare professionals. They don't have to be, although they could be. But primarily, we're looking for individuals who are current staff members at a YMCA across Canada, or we're also in a couple other countries as well. For this training, for YMCA staff, they must have safety checks in hand, as well as police check records and fitness certifications. Sorry, first aid and CPR certifications. And the goal of this is really for us to be able to attract community dwelling members across Canada rather than having licensed healthcare practitioners, because we're confident in their abilities to deliver this program and speak to the local needs of what individuals may wish. I have a great question about patients that are not tech savvy. Is there another way to sign up other than the website and the QR code? Thanks so much for that question. Absolutely. And I appreciate sometimes even multiple times I can't get the QR thing to work on my phone if I don't have it properly zoomed in. We definitely have hard copy pamphlets and tearaway sheets, etc. And we'd love for those to be offered to patients who are not comfortable with scanning a QR code or just really want something physical, or quite possibly they just want something to consider. They don't want it to rush. They're not deciding on signing up right away, but rather they just like to kind of read some material. So we'd love to send that your way. I'm still zipping through questions here, Kira. Please join in if you have some on your end. So according to Diabetes Canada, individuals are at risk developing type 2 if their A1C is 5.5% or more. Why 5.7 for this program? This is again, what we are referring to is the landmark trials of 5.7% to 6.4%, using IDF standards for consideration of what prediabetes is, and all the past literature on can we reduce risk of the progression of prediabetes to type 2 has been based on the range of 5.7 to 6.4%. I believe Diabetes Canada is at 6.0%, but I can see if there's a recent modification to that. Yeah. And yeah, great question. Also about where we're offering the program in terms of the physical structures. In this map, they are all YMCA's. In rural and remote areas that we are also in, these are not in YMCA's as they don't have YMCA bricks and mortar facilities. But for this particular program, which is no charge to participants, that we are in YMCA's. Um, and additional question on if there is an actual physical activity component. Great question, and thank you. I didn't mention that. There is an actual physical activity component. So I discussed 6 1-hour one-on-one sessions. 40 minutes of those minutes are about counseling or on counseling, and about 20 to 30 minutes are on actual engaging in aerobic exercise. And in also just a reminder here too that for individuals that might not be tech savvy, or for individuals who are just interested, let's say patients want to just check it out, they can also go directly to their YMCA in any of these locations and discuss the program with any member of the front desk, or discuss the program. They're all well aware, and they can maybe answer questions that individuals may have. Yes, great points. All right. Think I maybe got them all. Those a flurry of questions, and I really appreciate all of them. And I'm happy to expand more or discuss or answer any other questions. Oh, I just had a new one come in here as well. Yeah, so yeah, healthcare provider saying that they had a patient with gestational diabetes. Their current A1C now being at 5.5%, but unfortunately that doesn't qualify uh, them for small steps for big changes. And it's really unfortunate because you're absolutely right. Being experienced or having a past experience of GDM or gestational diabetes absolutely increases their risk of developing type 2 diabetes in the future. And yeah, it was, what we want to make sure is that we're basing all of our uh, content and our past effectiveness scores on our randomized controlled trials and pilot studies we've done. And those have all been based on individuals who had a A1C of 5.7 to 6.4%. We do think there's opportunity, absolutely, for expanding those criteria, and we look forward to doing that first. We look forward to doing that in the future, but the first thing we need to do is go back to the lab and test it in more controlled settings of, for example, individuals with a A1C of 5.5% to assess the effectiveness and on outcomes for those individuals, and then we can expand criteria. Mhm. And for those new questions, great to hear. Keep the questions coming. There is no charge for the program for somebody who just asked. It's at no cost to patients or to anyone in the community who is at risk of type 2 diabetes. They can, like I said, go to their local YMCA, or they can simply log on to our website, or which will take them to the program details. Yes, I can put that back up. Thank you. And then I'll go back to the questions after this. But I will put this up. Okay, great. Great. Some more questions. I think I saw monitoring in there. Do you recommend glucose testing or review the same, or is there more aligned with the anthropometric measures? So we definitely, you're good eye, astute. We definitely talk and counsel on the importance of self-monitoring. And although we don't highlight or express the need for things like continuous glucose monitoring or fingertip blood glucose assessments. We just recommend we're focusing here on monitoring diet and exercise behaviors. And we have some, freely recommended evidence-based apps for that. But we also recommend simple activities such as journaling or logging on paper and pen. We do assess for those in a sub-study, we do assess blood glucose before people begin the program, 12 months after the program concludes, and then again at 24 months after the program concludes on blood glucose, so HbA1c. And we also do the same measures for those same time points for those anthropometric measures of cardiorespiratory fitness and weight, waist circumference, etc. Yeah, there's no maximum age in this program, but we do have a minimum of 18 months, or sorry, 18 months, 18 years of age or older. So individuals who are adults. And similar to the other question about GBM, yes, this is because we haven't tested this in individuals who are younger than 18, although we think it is likely that there will be of benefit, but we want to make sure that we go back to the lab and test it in individuals younger than that age prior to offering it out into the community. Yeah, and so there is, oh, I missed it. Great. So individuals who are interested in receiving promotional materials can share their information in the chat as well, and we can send that your way, or you can send emails to these email addresses on your screen here. The criterion, I'll put that up again for sure. So existing eligibility are listed here. Okay. Well, I just want to say again, I really appreciate your time and attention today, but particularly appreciate your great questions. And I hope that I've answered them. If I haven't, again, feel free to reach out. I'm more than happy to pick up the phone as well and give anyone a call. We'd love to share this information and send have people in the community who could benefit from the program. We'd love to see them. We'd love to be able to try to assist them in their health goals. Um, but with that, perhaps we'll conclude. I'll stay online for another couple of minutes. If you have any other additional questions, feel free to type them in. Otherwise, thank you again for your time today. And please share this recording if you wish with other practitioners that may be of interest. Thank you.